Assalamualaikum to everyone. I'm Dr. Tuan Salwani. So in this session, I will share regarding a test that very important to monitor diabetic complication, which is urinalysis. Urinalysis means we analyze the presence of any substance that present in the urine at higher amount than normal. Example, we look for protein, glucose, or ketone in urine. In diabetes patient, the urinalysis is part of regular monitoring to determine whether the patient is having diabetic complication or not. Our focus today is assessment of diabetic complication, which is diabetic nephropathy, and acute complication, which is diabetic ketoacidosis. First, in uncontrolled diabetes, we are not only detect high level of glucose in blood, but also glucose in urine. Glucose in urine, we call it glycosuria. So normally, urine contains no glucose because the kidneys are able to reabsorb all of the filtered glucose from the tubular fluid back into the bloodstream. Glycosuria is nearly always caused by the elevated blood glucose level, most commonly due to uncontrolled diabetes mellitus. The proximal tubule can only reabsorb a limited amount of glucose. So, when the blood glucose level exceeds renal threshold, the proximal tubule becomes overwhelmed and begins to excrete glucose in urine. Rarely, glycosuria is due to intrinsic problem with glucose reabsorption within the kidneys, such as in Fanconi syndrome. Glycosuria leads to excessive water loss into the urine due to osmotic diuresis, and that's why uncontrolled diabetic patient has symptoms of frequent urination. In children and in pregnant women, the renal threshold is a bit lower. Thus, sometimes a normal level of glucose in blood children and pregnant women, mild glycosuria still can present. Next is proteinuria. Proteinuria means protein in urine. Proteinuria might be a feature that suggests diabetic nephropathy in diabetic patients. When the nephron of the kidney are not working as well as they should, they can let some protein escape through their filters into the urine. Besides that, diabetic patients may have high plasma ketone, which subsequently goes into the urine. So ketone will be increased in urine and we call it ketonuria. You should recall back on how and why ketone is formed in diabetic patients. Please remember, ketone also can be present in starving individuals due to oxidation of fatty acid from lipolysis in adipose tissues. In practice, we do dipstick tests as bedside testing or in small laboratory near clinic or ward to get the prompt result. So in practice, we have combo 3 and combo 10. As you can see, the combo 3 has 3 parameters measured, which are protein, glucose, and pH, while combo 10 has 10 parameters measured. So depends on the availability and the aim of the test done, we can determine whether to use combo 3 or combo 10. So as you can see on the test strip, there are test packs which contain specific chemical that react with the specific analyte inside the urine. For example, if let's say glucose present in the urine, then that glucose will react with the glucose oxidase and peroxidase on the test pack and produce color changes from yellow to green. Before the procedure, make sure you identify the correct sample for the correct patient and make sure the type of test or parameters that we want to look for. Dip the test strip completely for no more than 1 second. Excessive urine on the test strip may give rise to false result. So remove excess urine by touching on the plastic film on the rim of vessels. For more clear picture, again I show the step of the procedure. Step 1, dip the strip into the urine, or you can also use the pipette to apply the urine on test strip. Then remove excess urine. Either you follow the step 2, or you also can remove the excess urine by gently blotting the lengthwise edge on absorbent paper. Wait for the reaction to occur and compare the color changes on test strip with the color chart on the bottle. This is common error that students did during exam. They hold the strip upside down. This is for combo test, so you need to identify which kit that you use. So for combo test, this is the correct way of holding the strip when comparing the color changes on the test strip with the bottle. However, certain kit like this self-stick test strip, this is the correct way. So carefully read the instruction on the test kit. But in practice, we use combo 3 or combo 10. So at least you know how to hold the test strip of combo 3 or combo 10. Again, please carefully read the instruction given on each strip bottle. Usual time for the reagent on pack to react with the solid in the urine is between 30 to 60 seconds. So make sure we read the result only after certain recommended time. But the reading shouldn't be delayed. Any changes after 2 minutes are of no significance. So now, let's do some practice. We have a patient known case of diabetes presented to a clinic for regular follow-up. The result of dipstick test, protein 1 plus, glucose 2 plus. So the prevention diagnosis can be diabetic nephropathy. So how to confirm whether this is case of diabetic nephropathy or not? We can do 24-hour urine protein, or we do albumin creatinine ratio. Second case is a diabetic patient came with severe lethargy and confusion. Glucometer showed 22.0 millimole per liter. Urine glucose and ketone were 3 plus and protein 2 plus. So possible diagnosis is diabetic ketoacidosis. Important for us to revise again the pathophysiology of diabetic ketoacidosis, and we should be able to explain why ketone, glucose, and protein present in the urine. These are two common scenarios seen in our patient. Before I end this session, I need to bring back something important related to urinalysis by dipstick test. The dipstick test cannot run from limitation. Substances that cause abnormal urine color, such as drug containing azodine, may affect the readability of reagent areas on reagent strip, and the interfering factor for each reagent on test strip are different among each other. Another important aspect is performance check. The strip must be properly stored and handled before and during the test. Reaction of the reagent strip should be confirmed by testing known positive and known negative specimen to make sure the result produced is accurate and valid. I think that's all regarding urinalysis related to diabetic complication, and I hope everyone able to practice the procedure, and most important is the interpretation, and always interpret together with the clinical presentation. Okay, thank you for listening. Biochemistry is crucial but easy. See you in the next session on more topics. Bye and Assalamualaikum.